Welcome to theanimazing.com, and I'm JJ Yong, the presenter of today's Speedy review on DNA testing in detection of prostate cancer. And let's look closer to the male reproductive system. Prostate gland is a gland in male reproductive system which helps to make and store seminal fluid, also known as an organic fluid, or what we call semen, and it's located under the urinary bladder and in front of the rectum, as you can see in this picture here, as labeled circled here in yellow color. And one of the factors of erectile dysfunction is prostate cancer, which affects men from having normal erection. You can see that prostate cancer, it's a highly affected disease among men, and the most common in the United States for the men over 50 years of age. And these high rates may be affected by increasing rates of detection. And prostate cancer is one of the most life-threatening disease, and it's a slow-growing cancer among men. Let's look at the stages of prostate cancer, and we briefly discuss stages from 1 to stage 4 as shown in this diagram. In the beginning, in stage 1, there are small clumps of mutated prostatic cells start to divide rapidly, which before it's spread to the other organs. And in these subsequent stages, for example, in stage 2, small clumps of mutated prostatic cells keep increasing over a period of time and start to spread to the surrounding tissues or nearest surrounding tissues, which is around or nearby the prostate glands. And eventually, especially in stage 4, which is the metastasis stage, where cancer may spread to other organs, which could lead to intense difficulty of curing of this disease. Nevertheless, prostate cancer is a common life-threatening disease among men, so detection of prostate cancer is the most effective way to treat this disease. DNA testing is currently used as PCA3 test, which is based on PCA3 gene, which is also known as prostate cancer gene 3, which is a non-invasive test based on measuring expression levels of PCA3 gene in a urine samples, and used as an addition tool for prostate cancer detection, and it has a high sensitivity detection tool, and which is increased the likelihood of positive biopsy. And confirmation biopsy means shown in this picture, medical tests involving removal of cells of tissues for examination. We can see PCA3 specimen collection here, as this picture shown about digital rectal exam, also known as DRE in short. So in this test, the physician or examiner will take 3 sweets on each side of the prostate by using a glove lubricated finger into the rectum, and to check the condition of the prostate in terms of the size, shape, and texture. After that, the urine is collected with a urine container, and it will here sent to laboratory for analysis. And here, urine sample PCA3 test, it can be useful tool to detect prostate cancer, which is according to study, which is much better than PSA detection. Now I can summarize that the collection of urine samples, in the beginning you should have digital rectal examination procedure, and you get urine sample for PCA3 test. So detection of cancer cell directly, it involves basically 2 procedures, which is one is PSA protein test, while the other one is based on the urine samples, which include prostate cell and cancer cells, based on the detection of a PSA or PCA3 gene. Well, currently PCA3 gene has solved the dilemma of the use of PSA test based on one study. here, look at the advantages of a PSA3 test. So in the beginning, it's just to prevent unnecessary biopsy, and it's proven that's much better than PSA, which is prostate serum antigen test from blood samples. So it's found that it's useful for men who have a raised or high levels of PSA, but a negative prostate biopsy, which show them to spare them from repeated biopsies, where it's also for men with slight raised levels of PSA, and also useful for men in other clinical symptoms that suggest the possibility of prostate cancer. I'll bring a look here. Unlike PSA, PSA3 gene test is not elevated when a man suffers from disease that increases the size of his prostate glands. And I can say that there's some disease that's not actually related or causes of this disease, which is prostate cancer. One of it is actually, we call it BPH, or benign prostatic hyperplasia. And you can see here, high levels of BPH does not mean it will cause cancer. And here, the higher the expression of PCA3 in urine, it shows the greater the likelihood of positive biopsy, which shows that presence of cancer cells in prostate, it can be detected much efficient compared to a PSA test. Here I will conclude my presentation today, and thanks for listening in this speedy review on prostate cancer, and hope to have time to log on to my website dnaamazing.com for more information about DNA testing. Thank you very much for your time. Goodbye.